Mr. President, the American people do indeed want health care reform, and they want us to take the time we need to get it right. As I've said repeatedly, and as an increasing number of senators and congressmen from both sides of the aisle are also now saying, the last thing Americans want is for Congress to rush through a flawed bill that would make our health care system even worse, so politicians here in Washington can have something to brag about at a parade or a press conference. The President and some Democratic leaders in Congress now acknowledge that getting health care reform right is more important than rushing through some slipshod plan no one's even looked at and calling it reform. Last week, the President said he wants to get health care reform right, and that the most important thing is that members of Congress continue to work together on the difficult issues in this debate. And one senior Democrat said last week that, quote, it's better to get a product that's based on quality and thoughtfulness than on trying to just get something through. I absolutely agree, and so do all Republicans. And so we're encouraged to hear our friends on the other side acknowledge that health care reform is too big, too important, and too personal an issue to rush. In the coming weeks, Congress should work to achieve real reforms that actually address the problems in our health care system without tampering with the things that Americans and many other people around the world like about our health care system and can no longer find in their own countries. The American people want health care that is more affordable and easier to obtain. What they don't want is a government takeover of health care that costs trillions of dollars, adds to our unsustainable national debt, forces them off health insurance they already have, leaves them paying more for worse care than they now receive, and leads to the same kind of denial, delay, and rationing of care that we see in other countries. One thing Democrats and Republicans should be able to work together on are practical ideas the American people want, such as reforming malpractice laws and getting rid of junk lawsuits against doctors and hospitals. The President has already acknowledged that both Democratic bills working their way through Congress aren't where they need to be. In fact, by the President's own standard, that any health care reform must not increase the national debt and must reduce long-term health care costs, he wouldn't even be able to sign either of these bills we've seen so far. According to the director of the Congressional Budget Office, both bills would lead to an increase in overall health care costs. And just this weekend, the CBO said there's a high probability that one of the administration's central proposals for reducing long-term costs wouldn't lead to any savings in the near future and would generate only modest savings in the future. Moreover, even if this proposal did generate any savings, they would likely be dwarfed by the new spending and deficits in the Democratic bills we've seen. It's like charging a new Cadillac to the family credit card and getting excited about saving a few dollars on the cup holder.